Welcome to the Institute for Emergency Medicine. Let's go have a look inside.
Hi, my name is Selina Kim and I'm a researcher at the Institute. My academic background is in social sciences and statistics. I'm also a team member of the Progression project, and we as INM are the project coordinator of Progression. That means we are responsible for the management and coordination of the project itself, the consortium and the project activities. One of these activities is the development of the virtual and augmented reality application, which is a main part of the developed learning concept.
Hello, my name is Mark Lazarovic. I am the project leader in Progression and also the head of the Human Simulation Center, which is our simulation and education lab. I'm going to briefly show you around our lab. In this first space, we can present different scenarios, but for now we are using it for a study regarding presence in virtual reality, and this is the setup for our study. Let's have a look at the other rooms. Now we can have a look in the second room of our simulation center, which is one of the clinical spaces. Here we use different equipment like the normal anesthesia equipment, some syringe pumps to train people in different healthcare scenarios. But for Progression project, the most interesting part happens in the next room where we are going now. Now, here is where the music plays. In Progression, which is an Erasmus Plus cooperation partnership made up of 5 partners all across Europe, we are developing VR and AR applications to teach future midwives about the subtle movements of the pelvis during maneuvers in obstetrics.
Hello, my name is Frieder Pankratz and welcome to the Human Simulation Center, our laboratory where we created the Progression project. Progression is an AR and VR program to teach midwives the movements of the pelvis of a pregnant woman during the later stages of the pregnancy. Using the VR mode of our application, the students can move the limbs of a virtual mother and see how the limb movements affect the pelvis. In the AR version of our application, you can place a virtual mother into a real room and interact with her in there. Or you can use a different student to act as the mother and do all exercises with her.
After this short presentation of our institution and our project, I can only invite you to visit our website where you will always find current information on the project.